Today, we're diving into the growing crisis at Cedar Hill Regional Medical Center, the first full service hospital to open in Washington, D.C. in over 25 years. It opened April 15th with high hopes and a $434 million price tag backed by a public private partnership between Universal Health Services, George Washington University, and the D.C. government. But just 45 days in, the hospital has already had to divert ambulances 5 times. Staffing shortages and a wave of emergency departments visits have far beyond expectations. So, Cedar Hill was built with 80 inpatient beds, but has only 32 of those open. They expected 100 emergency patients a day, but they're seeing more than double on some days. And here's the kicker: nearly 80% of those ER visits could have been handled at an urgent care. The community's lack of transportation, childcare, and flexible work hours means people are defaulting to the ER for everything: colds, fevers, minor injuries. This hospital replaced the now closed United Medical Center, but it's stepping into a growing public health gap that was underestimated. DC added 15,000 new residents last year, almost double the population growth from the year before, and Cedar Hill simply wasn't built to absorb that spike in demand. So now the hospital is scrambling. They're offering nurses $15,000 sign on bonuses and sending out postcards to residents explaining when to go to urgent care versus the ER. Leadership is even bringing in a grad student to help craft a health literacy campaign. But the bigger question remains: can a shiny new building fix decades of systemic neglect in community health access? This isn't just a Cedar Hill problem, it is a warning to every city betting on new hospitals without investing in the infrastructure that actually keeps people well.